Hello everyone, my name is Alicia Jackson. I'm a licensed professional counselor, and today we're going to talk about some common myths about ADHD. I have been really hesitant about talking about diagnostic, like specific information about diagnoses, just because I know that we have a tendency to diagnose ourselves on the internet. And that is not the purpose of these videos. These videos are not for you to diagnose yourself. And that's not the intent of these videos. These videos are just to help you have more information, psychoeducation, to provide psychoeducation to you. So I submit that to you by saying, just take in this information. Of course, for those who are looking to provide or receive more information about ADHD or any other diagnoses that I might share in the future, and try not to diagnose yourself. Okay. Leave it to us. All right. So, some common myths about ADHD. ADHD is a tricky diagnosis. One of the reasons why it's a tricky diagnosis is because it is not named accurately. There are 3 different types of ADHD, and the name is attention deficit hyperactive disorder. So that is what ADHD stands for. However, hearing that, you hear attention and hyperactive, right? Attention deficit means you can't focus. Hyperactive means you run around. Okay, so that means that you would assume, right, that that's all ADHD encompasses, and that is not accurate. It is truly a executive functioning disorder. If I had the power to influence the DSM authors to rename it as an executive functioning disorder. So we'll talk about what executive functioning means. I have a whole series about ADHD that's coming up this month. So, pack your patience, because I could go on and on and on about ADHD. I have a lot of experience with it. And so I wanted to first kind of start by just like dispelling some myths before we start to educate ourselves, okay? So one of the myths is that ADHD is something that you can like grow out of. That is actually inaccurate. ADHD is something that you are born with, okay? It is how your brain functions, and it's something you born with. Now, what you can do is find ways to work with it and provide structure for it, so that it can help you. It doesn't interfere with like your daily living functioning. So one of the tools that people often use who have ADHD, they use a calendar. Oftentimes people who have ADHD have difficulties with their memory, remembering things, remember where they're supposed to be, remembering what's supposed to be with what. And so having a calendar, having a way to keep a tally of all the things that you need to do on a regular basis, that is something that you can utilize to help you stay present, stay focused, stay on task, all of those things. There are different things and strategies you can use to help manage your ADHD, but it is not something you grow out of. Sorry. Okay. So that's where you will hear language of like adult ADHD or child ADHD. If you have it as a child, you have it as an adult. And if you have it as an adult, you had it as a child. I know. A lot of different language out there. But adult ADHD is may present a little differently, because again, you have kind of learned how to work around some of these difficulties, like inattention, like maybe you doodle in meetings, because you know that there's no way you're going to stay focused for an hour or two, and so you have found ways to work around your inattention, but it's still the same symptom. It just looks differently because of the age appropriate activity that's happening. It's no longer socially appropriate for you to be maybe running around in a staff meeting, right? But if you're like constantly like, oh, I gotta go to the bathroom, or you're constantly like on your phone while you're in a meeting, it's hard for you to stay present, things like that. that is how you might see it as an adult. Same symptom, just presented differently, but it's the same symptom. So adult ADHD, child ADHD, similar, just presented differently. Make sense? Makes sense. Myth number 2. Myth number 2 about ADHD is that you can discipline it out of a child. That child must be just bad, and that's why they're this way. That is unfortunately a very stigmatizing myth. It stigmatizes the parent and it stigmatizes the child. Calls the child bad, and then you're indirectly calling the parent bad. Like they don't know what they're doing with their child. Not okay. But no, that is a myth. So again, we're talking about a brain, how the brain functions, okay? And yes, again, we can provide structure. Structure is ADHD's best friend. Woo! ADHD loves structure. It's like, give me a schedule, give me something to know what to expect, give me time. That helps with managing your day, managing your daily activities, all of that. That helps a child specifically to manage their ADHD if they have structure. If things are kind of loosey-goosey, we don't know what time we go to bed, what time we have dinner, what time it's snacks, what time do we go do our homework after school. If we don't have times and structure for all of those things, it makes it really hard for a child to regulate themselves and regulate their emotions with it as well. Okay, and so yes, structure can help ADHD, but it does not fix ADHD. ADHD is a neurological disorder, and it is how that person's brain functions. They have an executive dysfunction of their brain, and no discipline or corporal punishment, because I've seen memes. I've seen them. No corporal punishment can fix it. Okay? Take a breath. Because I know that's a lot for some people to hear. So I'm willing to honor that. I'm that therapist. Like, we're going to honor that feeling because I know that was a lot for you to hear. All right. Okay. Now, myth number 3 about ADHD. Now, here's the thing. A lot of people feel like ADHD is not even a diagnosis. Like, it's not real. People feel that way. And I understand and have compassion for people who do feel that way. Reason being, because ADHD is often overdiagnosed or misdiagnosed. Sometimes people don't even assess for it. Sometimes people look for it. Okay? So, ADHD can look like a lot of things when looking at a person. ADHD can look like anxiety. ADHD can look like trauma. ADHD can look like sleep apnea. ADHD can look like so many different things. And that's why psychological evaluations are so important. Any client that comes to see me is going to get like a first kind of preliminary evaluation, even if they've like come to see me just for that, or if I'm working with them and then working with them, I'm like, maybe we should do like the preliminary screening for ADHD, and then having that conversation with them, because that is a lot to unfold. And then once we do the preliminary screening, if what I was picking up is something that is kind of being shown from that screening, then I would recommend a psychological evaluation. Why is that so important? Data. We want to make sure that we are making this declaration, making this decision with data and not objectively just by observation, because again, ADHD can look like so many things. So in that psychological evaluation, they're going to be evaluating like working memory and a lot of different things that encompass a diagnosis of ADHD. Okay. So yes, it is a diagnosis. It is real. Are people overly diagnosed? Yes, unfortunately, especially in places of color, people of color, unfortunately, children are often misdiagnosed with ADHD, and really they've experienced just trauma. And it just unfortunately stigmatizes the trauma that they are that they have felt, and even almost, and also it re-traumatizes the child, unfortunately, because then they're labeled and the students viewed as bad. And it's a whole mess. It is a whole mess. But I do again have compassion with those who feel like, oh, it's not a diagnosis because it's overly diagnosed. My child didn't have it, and all of this. Definitely agree with you 100%. And at the same time, ADHD is an actual real diagnosis. It is an actual real mental health disorder. It's real. Okay? Take a breath. And the last one, number 4. The fourth myth of ADHD. It can be really hard. I think we're still learning, right? We're still learning and growing in regards to mental health and mental illness. And oftentimes, people feel like the diagnosis is just saying that you're trying to put my child on medication. Okay. And that's often, it can feel that way as a parent, especially in the school system. And schools, like, seeing some things, they're like, hi, Mr. and Mrs., your son or daughter need to be evaluated. And that's the other thing. Girls can have ADHD. They can. It's not just boys. Oftentimes boys, because they're more, they have just more rambunctious by nature. Girls are just socialized to be more calm, but they also have inattention that's happening inside, and daydreaming and all the like as well. They're just, again, girls are socialized more to be more sit ladylike, be calm, versus boys, we allow them to be more physical, just be more free with their bodies, and so they are more rambunctious in a school setting, right? But boys and girls can both have ADHD, and also receiving a diagnosis of ADHD does not, hear me, does not necessarily mean that medication is all the time necessary. Okay? It does not necessarily mean that medication is all the time necessary. It can be very helpful. Studies have shown that the best outcome for ADHD is therapy and medication. Therapy and medication. My recommendation for individuals is always to go to a psychiatrist, or again, to go to a psychologist to get that evaluation, and to have a follow-up with a psychiatrist. Not that medical doctors are not effective. It's just best practice. Because psychiatrists, they have all of their studying is strictly in regards to just prescribing psychotropic medication, versus a medical doctor, they have the knowledge of that, but it's not concentrated. And so to get the best practice, to get the best outcomes, it's recommended to get a psychiatrist. I know some people have more of a relationship built with their medical doctor, understandably so they feel more comfortable, and I understand it, and I get that. It's just something that I recommend, just because, again, psychiatrists, they have the concentrated information about just prescribing psychotropic medication, which of course includes treating ADHD. And so if there's other factors, if there's other things going on, that they can also treat that as well. And you'll get the best treatment that that your child or you deserve. Okay, so no, ADHD isn't something that happens in any specific time. It is truly just something you're born with. And it is not something that is specific to a gender or a specific time in your life. If you're born with it, you're born with it. You can't discipline it out of a child. It is something that they have with them. And yes, you can provide more structure. Structure is always helpful for any of us, but specifically for ADHD child, structure is like, it's like warm milk to a baby. It's just so comforting. You have no idea. It's like, oh, I know what to expect. Okay. It helps. It helps the child so much. And medication is oftentimes recommended, but it is not always necessary. And you, as the parent or person who has ADHD, you have a voice. I always tell my families, my clients, that yes, I have these letters behind my name, and at the same time, you are expert on yourself. I can't tell you what's best for you. You make that decision. You make that decision. If a doctor or a therapist is telling you something that you don't agree with, use your voice. Use your voice. Okay? So, these are some myths about ADHD. We're going to continue on our journey and learning more about ADHD. If you have any questions below, please feel free to ask and share. Share this video with any people that you feel might benefit from it. And thank you so much for watching. Oh, and how could I forget? Subscribe to my channel. Subscribe to my channel. I'm just saying. It's time. It's time. Take care so much, and you guys have a blessed one. Peace.